Since early times, drugs have been used and abused throughout all of the world. Opium was widely used during the early civilizations in Great Britain. However, it was grown and produced in China. Great Britain became so hooked on opium and China stopped exporting the drug. Following the opium addiction, many other drugs came about. Some examples of modern drugs are aspirin, ecstasy, and marijuana.
Aspirin. Unlike many other drugs, aspirin can be bought anywhere and can be used openly. Aspirin is considered to be safer because it can be used to treat many common pains. Although compared to other NSAIDs, non-steroidal anti-inflammatory drugs, it may not be the safest. Other NSAIDs include ibuprofen, irritates stomach and esophagus slightly less than naproxen and aspirin. Aspirin prohibits COX, in turn stopping the formation of prostaglandins. Hence, aspirin acts as an anti-inflammatory agent in this process. Like with all drugs, there can come many negative effects with its consumption.
Ecstasy is the next drug. Ecstasy can be taken through tablets or capsules. It can cause a high heart rate and blood pressure, higher body temperature, jaw/teeth clenching, sweating, nausea, blurred vision, faintness, confusion, insomnia, depression, sleep disorders, anxiety, liver and brain damage, and it also alters the function of serotonin and dopamine pathways in the brain. Ecstasy induces the release of serotonin reserves, a neurotransmitter that helps regulate mood. In addition, ecstasy prevents reuptake of serotonin, further increasing concentrations and inducing feelings of euphoria. Due to its mood-altering ability, some seek to legalize MDMA, aka ecstasy, for therapeutic purposes. On the other hand, claims about permanent serotonin receptor damage have been made. This damage could be responsible for a decrease in memory and other function regulated by serotonin. The pH of ecstasy is about, on a scale of 1 to 14, a 3. It's mostly acidic.
Marijuana. Smokes, sometimes mixed with food, can cause memory and learning problems, distorted perception, increased heart rate, anxiety, increases of chronic cough, bronchitis, emphysema, increase of testosterone levels and lower sperm count for men, cancer of the head, neck, lungs, fat soluble.
Marijuana is also known as THC. THC is stored in the body's fat cells. The human organs that contain the most fat and therefore store the most THC are the brain and reproductive organs, the ovaries or testicles. The storage of THC in these organs has significant consequences for both men and women. It reduces levels of testosterone, which equates to reduced ability to gain lean muscle mass, so no gaining muscle weight. It also reduces libido and sperm count. It disrupts menstrual cycles for women and increases the development of the mammary glands in men. This is known as gynecomastia. It also decreases the effectiveness of the immune system. After having consumed THC, it takes about 2 to 10 days for the body to dispose of the drug. Of course, it depends on the amount ingested. The pH of THC is a 3.7 on a scale of 1 to 14. THC's chemical structure is similar to the brain's chemical anandamide. The brain is then tricked into thinking that the substance is a natural brain chemical that helps the brain work the way it does, therefore altering the way we see things.